there's a few points coming out around displaced and what are termed migrant and international workers. We're aware that many people are telling us that renewal of licenses is very slow. We have spoken to the Home Office UKVI, who don't think there's a problem. We've also spoke to the Department of Health, who liaise with the Home Office UKVI. They don't think there's a problem either. We've asked for the issue to be escalated. But if you are having problems, please let us know, and we will see what we can do. We've asked the Home Office to come to an event. They have turned it down on the basis that there's no changes since October. We've got a sort of update document that we're just revising at the moment. We'll put that on the website shortly. What I would say to you is, if you take advice around displaced workers, do make sure that you're getting the right advice and that it is current. Obviously, Dudley and myself, we're not experts in this. We can give you some information, but if you want, cut and dried, then you're going to have to use a lawyer. And do get a lawyer that actually knows what they're doing, because there's a few sharks in every trade. Enough on that miserable thought. Dudley, over to you.
Thanks, Peter. Thanks for sharing. And really going back to the point, it's a busy time, and it's going to be even getting more busy for those, especially for December. And we know that we've got another meeting in December, but leading up to that time, there's lots happening in the sector. And if you blink, you miss it. But obviously, you run as a business. And so we also know there's other needs and other things. It's not just about one thing, it's about various things. And it's a conversation I've been having with various providers. If it's not one thing or another, Peter and I are doing our best as we can to cover all the things that are happening, that you hear from the government, the DH, anything that's relevant from the NHS or anything, ICS, ICBs locally. We're trying our best to share as much information as possible. I'm sure you're listening out openly for the fair pay agreement and everything in regards to that as well. So if you go onto the website, when we'll try and update you, and obviously via WhatsApp groups and emails, of the latest things that are happening, because we know what the impact it has on you as a business as well is very important. Going back to Peter's point as well, we are trying to do a lot of work with information around the displaced and sponsored workforce as well, but also as well trying to signpost you as well for those where you can get registration and what to do next as well. We are running some sessions in different parts of London at the moment, but we also are factoring the importance of the actual international recruit as well, considering the current climate that we're hearing around things around migrant workers or migrants as a whole. And so the safety of that workforce is also important as well, because we also want them to be able to live and thrive and to give the best care possible. And by that, it's about their well-being being a good place. Other than that, we will try and update you with as many changes as possible in real time. We are patched into what is known as the CAA, which is all the care associations around the country. We come together and we share information, update. We're at meetings and sitting at hopefully at high tables where we can make a difference. But one thing that we do find with the CAA is that with London being such a big place, actually the voice of London probably should carry a lot more weight than the other areas, but it doesn't. So if you feel there is an issue or concern to be had, please send a message to Peter and I. He'll put the information and details. I'm sure you have it already in the chat. If you need to get in touch with us, then we can then get together with other providers so we can put something together, be it CQC or any other sort of body that there is as well. Other than that, please enjoy today. We've got some great speakers today and information and any questions you may share. The slides will be on the website as well, but also as well, you can get in touch with us afterwards or with the speakers if you need to as well. Other than that, I'm sure we will pop up and down during this meeting, and I'll leave it back down to you, Peter.
Okay, thank you very much. Before we move on to Tawanda and the Nursing and Midwifery Council, I just want to quickly flick through some slides around the CQC survey. We have got also some information upon the Fair Wage Agreement and the Employment Rights Bill. And I appreciate that some of these things are in the future, so they're not actually imminent, but it pays to see what's coming down the track, and to make sure that you're aware. The reason that we are pushing or trying to encourage you in that sense to take the right. How do I get to the full screen? Can you see the screen, Dudley?
Yeah, we can see it.
Okay, I'm just trying to find out.
Just click on slideshow. Yeah.
There we go. Fantastic. Okay, thank you very much. One of the complaints we get from the CQC is that people don't answer their surveys. So I would encourage you to download this one and to do it. It's actually on the platform until the 25th of November. You don't have to answer all the questions because some of them are NHS only. So it's about their proposals to evolve and improve their approach, which has been pretty poor over the past period. And we want to make sure that adult social care is fairly represented and that the CQC do the best possible job. So to flick through the key questions, it's basically a tick box exercise. They're looking to simplify their gradings, looking to simplify inspections, and also, frankly, to get the number of inspections up, which we all desperately want. Many of you, I suspect, will not have been inspected for several years, and it's not acceptable. And it makes providers look poor, particularly if you've got RI and you want to get out of RI. They're proposing to develop a framework of supporting questions similar to the CLOEs. Under the whole thing, of course, the Act isn't changing. So it simply is a bit like changing the deck chairs on the Titanic, but we actually want it to succeed. Second question, again, tick box, but there's a couple of these questions that have got free text box. If you have got points, put them in there. Let CQC know. We're actually meeting with CQC senior people shortly because we're asking them to come to meetings, to come to a couple of meetings next year, one at the beginning of the year, one later in the year, to see how they're moving on. And a part of that is around getting the numbers of inspections of adult social care providers raised. They're hitting their target, but many would say that target is not very ambitious. So again, you can see that these are not hugely complicated. Number 3, what extent do you agree with the proposed approach to making our assessment framework clearer? Well, I would have thought that everybody would want a simplified framework, and people want to avoid duplication. So no great complications. I don't see any great problems with any of these questions. Simplifying the rating approach, strengthening the role of professional judgment. They do seem to have done a very good job with upskilling and retraining of their assessors and inspectors. We all want a level playing field. Areas that have been criticised before are consistency, and where a CQC inspector and their team go into a specialised unit, they need to know about that unit. And if it's LD, for example, they need to know about LD. If it's dementia, they need to know about dementia. If you have a problem with inspectors, then complain. They want people to use the complaints process. If you have an issue and you don't want to address it directly, come to us. We can talk to CQC. We've done this before, and we've had various issues sorted out. They want comments about how they should support their teams. Again, it's back to expertise, but you need to make them aware of what you want, what you're not happy with, and how they can do better. Reviewing and clarifying their approach to following up assessments and updating ratings judgments. That's been a key issue. It comes up every meeting. It comes up week after week with providers. Their aim is to ensure that when they update ratings for service, their judgments are not affected by evidence or other ratings that are significantly out of date. Almost last but not least, you can read that. You can see what they're after. They are wanting to build in equality and human rights work in all their work. They've produced a draft equality and human rights assessment, which you can link to from the document. And they want to identify any good or outstanding practices within a service that results in more equitable access, experience, or outcomes for groups of people. Now, another meeting with CQC is with their team that Claire Brown is a key part of. So they're looking very hard to get this sector right. It's pretty good at the moment, but it could be better. Any comments? Tell them anything that you want to tell them. This is how you can actually get to the consultation. There's 2 dates somewhere in there. One is a November date and one is a December date. So I would go for the November date. And you can actually print it off, pop it in the post and send it back to them. But please, please do respond, because
you can do it online as well, Peter, as well.
You can actually do it online. It's simply there. There's several different ways that you can do it. And hopefully that's it. So that's that one. I will put that on the website, but please, please do pick it up. It has been pushed, and you can also make comments in there about inspections of local authorities. They aim to do all the local authority inspections or overviews by the end of next year. And if you disagree with those, as some providers already have, please do let us know, because it has been a point of discussion with them. And we look forward to hearing from you.
Just a quick point, Peter, before you switch on. I don't want to slow the train down. I think one of the big issues that have is that of them, and then they will then think that there's no problems or there's no issues. I know we have busy lives. Spending, I know we could have done it actually as a group just now. It probably would have been a lot easier, but spend that 15-20 minutes just to really just put down your points. The more numbers that give feedback, the more likelihood that things happen, not afterthoughts. As we know, there's been various changes at the top at CQC. We shouldn't wait till that happen. We actually should be the drivers in there. So on that note, Peter, I'll pass it back to you.
Okie dokie. And what I would now like to do is to pass it over to our guest, Tawanda, from the Nursing and Midwifery Council, which I seem to be struggling to say today. And would you like me to pull your slides up, Tawanda, or are you doing them yourself?
I think I can do it. Let me see if I can do it, and then if I can't, then you can help me. Can you see them?
We can. Fantastic.
Amazing. Okay. Good morning, everybody. My name is Tawanda Bvumburai. and I'm an employer-linked service advisor, and I work for the Nursing Midwifery Council. So I'm here today to tell you all about the NMC and my role, and hopefully I will be able to be of help to you. So so what it means to be a professional. So in terms of being a registered midwife, it is a trusted profession. The British Social Attitude Survey, they ranked highest since 2016 when they were added to the list. And it basically just highlights the privileged position that nurses are in. So they were ranked the most trusted profession, and that's without even knowing the individual or knowing the person. So generally, members of the public, I'm sure all of us have used NHS services and different services when we're unwell, or the GP or whatever it is. And we've come across nurses, and the public generally have a lot of trust in them. And they believe that nurses have their best interests at heart. So with this comes obviously great responsibility, and that's why it's so important that there's an independent body, which is us, who can set the standards that we expect them to adhere to when anything goes wrong. So so the NMC's role is to ensure that that public trust is justified and maintained. So trust in all these professions has increased in the last year, but with nurses particularly, it's seen like a 6-point increase since 2023. So that's just a little overview of what the public think about nurses. So in terms of the NMC and what we do, these are our core functions. So it's just to let you know what we do, and because I know sometimes it can get confusing with RCN and CQC and all these other regulatory bodies. So these are our core functions at the NMC. So registration. So we maintain the register of all nurses, midwives, and nursing associates who meet the requirements for registration in the UK. So they register with us, and then they pay money for us, and then they get their nursing PIN. And then we set all the codes and the standards. So the code and everything that nurses and midwives adhere to and adhere by, and we set that. So in terms of education, training, conduct, performance, all of those things, we make sure that we put in the codes and the standards that they're able to deliver this at a high quality and high standard across healthcare. And then also education. So we approve and assure all the programs for nurses and midwives in education across the whole of the UK. So we set those standards, and there's particular standards that they have to adhere by in order to pass the course and in order to get onto the register. Excuse me. And then revalidation. So every 3 years, nurses, midwives, and nursing associates have to revalidate, and there's certain things that they have to do to revalidate. Revalidation is a process that they all have to go through, and they have to do this to maintain their registration. So if they don't do that, then they can be removed from the register. Sometimes you have issues. I don't know whether any of you managers have seen issues where maybe people have not paid on time, or maybe they just haven't managed to do their revalidation on time, and then they get removed from the register for a short period of time, or some people just want to leave the register. But we are in control of the revalidation. And then fitness to practice, which is one of our core functions as well. So, for example, when an individual is alleged to be unsafe or otherwise unsuitable to continue their registration, we take action, so the public can have confidence in the quality and standards of care provided by nurses, midwives, and nursing associates. So, for example, if nurses do anything wrong, or you feel like they're working unsafe, then you can refer them over to the NMC. But I'll talk a little bit more about how we want that to go. So yeah, these are our core functions. So just things that we don't do, just so we can differentiate. So obviously we can see all these lovely people on the side: RCN, Unison, Royal College of Midwives, Unite, all of these lovely people, CQC, they're all here on that side of the screen. But what we don't do is we don't represent nurses, midwives, or nursing associates. We don't have a role in funding or training or continuing professional development. We have no powers to regulate employers at all. So we only regulate the individuals. We don't regulate health and care settings or services or commission training places. But we work with all the organisations in all parts of the UK And it is important work. So I do work with the CQC, I work with the RCN, I work with so many people across the board, because especially when it comes to the independent health and social care sector, sometimes what we're seeing that it's not necessarily a forgotten space, but it's just a space that is very difficult to infiltrate. I think when it comes to the NHS, it's easy for us to kind of just message the chief of nursing and say we need to come in and we need to do learning sessions on this or that, or if you want to talk to us about different things that are going on with nurses that have been referred to us, it's maybe a little bit more easier with the NHS because you can kind of contact one person and they can sort that out. But I think when it comes to independent health and social care, it's a little bit more difficult because we have SMEs, people that own their own businesses, and then there's local authority, and then there's NHS. So there's so many different parts and moving parts that we want to kind of get in there and let our presence be known as part of the Nursing Midwifery Council, which I feel we have not had before. And that's why we are having referrals that come to us that don't necessarily need to be referrals. But I'll talk a little bit more about that in a moment. So, excuse me, just to let you know a little bit more about my team. So I'm part of the Employer Link Service team. So we're split out into different regions. So we have regulation advisors. So the regulation advisors tend to be more with NHS, and they kind of are constantly in the loop with NHS and what's going on over in that space. And so we have different regions you can see on this map. We also have a regulation advisor for the independent health and social care, which is Lucia Cipriano. And then there is us, so the ELS advisor, so we're the Employer Link Service advisors. So we are under the regulation advisors, and we work. The reason why our role was created was so that we could work with the independent health and social care sector, make our presence known, let you know who we are, how we can help you. And guys, what screen can you see? Can you see Can you see the map on the screen at the moment? Oh, okay, perfect. Yeah. So yeah, just to so that's our role, to infiltrate the independent health and social care sector and have consistent contact with you, and for you to also have consistent contact with us where needed. So who we engage with, so employers of nurses, midwives and nursing associates, so you lovely people on the screen, professionals on our register, so the nurses, midwives, nursing associates, and then health and social care stakeholders across the UK. So there will be people in ICBs, lovely Peter and Dudley that are here today, different people across the board, stakeholders that can help us engage with employers and help us engage in the sector and give us intel and help us to understand the sector the best we can. So our support and collaboration includes, so advice to employers when concerns arise. So what we're seeing a lot is with the NMC is that we have referrals that come through to us from nursing homes or the independent health and social care sector, and they don't necessarily need to be referrals to us. So we're not sure how your processes work, whether it's part of your HR process or whether you feel like, okay, this person's done something wrong, so we need to refer them. So for example, we may have issues where maybe a nurse has given medication incorrectly, let's just say, or maybe they've given medication, haven't signed the drug chart, or they've given the wrong dose of medication, let's just say, for example. That's not necessarily a referral to the NMC. If it's something that's happening more than once, or it's something that's happened consistently over a long period of time, then yes, it would need to be a referral to us. But there's a lot of things that we want you to deal with locally before they come to us. And so we have different things in place that we can help you with before you get to the point of making a referral to the NMC. The reason why we're also doing this is because we do have a backlog of cases from COVID, and we're trying to work through those cases. And what we're finding is that when we get to the fitness to practice process, it's quite a long process, and it can take quite a long time for things to happen. So say, for example, you make a referral and then the nurse is informed of the referral, and then it might take maybe 16 weeks. It goes through screening, and then at the end of screening, they find out, oh, well, this is not really a case for us, and they close it. But I'm a registrant as well, so I'm a midwife. So I know that that is quite anxiety provoking. And also it just might not be something that's for us. So we're trying to be the middleman in between before you get to the point of referring to us, so that we can tell you, oh, this does need a referral, or this doesn't need a referral. So yeah, that's what we're trying to do. We're trying to manage concerns with the employers before it gets to the point where it needs to. And you might call us and it may need to be a referral to us, but we just want to work with you in that in between space of a nurse doing something that you deem is incorrect, and then to the point of referring to us. But what we also want as well is for nurses to feel confident in speaking up. So we're humans, like we do things wrong all the time, like in our daily life, like minus our professions, we do things wrong all the time. But what we want is for nurses to be able to speak up and just say, do you know what, I did this wrong, and I need help with this, and not to be scared of us. Because I know as a registrant, before I worked for the NMC, when I was clinical and I was on shift, all we talked about all day was our pin. I'm going to lose my pin. I'm not doing this because I'm going to lose my pin. So it's always on our minds as professionals, our pins. But we just want to encourage nurses to always speak up. Like, there's human factors, things go wrong. So yes. And there's just we've got different things that we have to help you to understand as well how nurses work, or different learning sessions that we need to do or things that we can do to help your organization or you as managers, or things that you need to come to us about. So just to let you know who we are and what we do and how we can help. So yeah, okay. And then, so the Employee Link Service Advisors. So it's been an established team for quite a long time. So it was just the regulation advisors and then the principal regulation advisors, but now obviously they've brought in us. So there's 7 of us. So we are across different regions. I am specific to the London region, so I'll be looking after London specifically. So yeah, so I think I've already explained that, but just to say again. So the professionals we regulate form the largest part of the health workforce. So we have the most people on our register out of all of the regulators. And it's a critical part of the social care workforce. So yeah, I think I've already explained this as well. Okay, so what we do is, so our core function is ELS advisors. So what we want to get out there and the support and the resources available at the NMC are not widely known. So I know that there may be a lot of managers on here that do know what we do, but there also might be managers on here that don't know what we do. So our point is that we want the NMC's core role and functions to be understood. We have an advice line and a managing concerns resource. So with the advice line, it's a really good line that can help you managers in terms of if you need to refer to us or not. That is manned by our regulation advisors. And what you can do is, if you have an issue with a nurse or a nursing associate, you can call the advice line. They're open Monday to Friday and 9 till 5. And you can call them and you can say, okay, I've had this issue with this nurse or nursing associate, if you do work with nursing associates. This is the issue that's arisen. Do I need to make a referral, or what do I need to do? And then what we can do as part of that advice line, we can give you advice on if it should be a referral, if it's not a referral, if maybe you want us to, you want to keep in contact with us about this particular nurse or midwife, like maybe you're handling it locally and maybe you put them on a plan to help them, but then maybe it's still an issue. We can help with all of that. We have a range of tools and resources designed to support professionals and their employers, which I can send some stuff over to Peter after this. We've got like a resource bank that will definitely be helpful to you guys. And honestly as well, it's an opportunity for the voice of health and social care to be heard in the core work streams. I just feel like we do need to get the independent health and social care sector really out there. And in terms of the nurses that work there as well, I know that it can be quite isolating for nurses that work in the independent health and social care sector, because maybe you only have 1 nurse or maybe 2 nurses that work on shift together. And so sometimes it can be quite isolating. And so we want to help with that. I know there's a lot of work going on at the moment to get nurses into the independent health and social care sector, especially with like skills for care. They're working with doing preceptorships and things like that to get people into the independent health and social care sector. I know that previously has been seen as kind of like an end of career type role, but I know that we're trying to change that, and we're also working with skills for care and CQC and the local authorities and things like that. So yeah. But yeah, we also want to support the NMC's ambition to develop a deeper understanding of the variety of learning and care environments across the UK, because we want to be everywhere and know everything so that we can help. So the support that we can offer to employers and your professionals, which I think you may find helpful, is that we can do learning sessions. So I can come in either physically or we can do it online, where I can come in, I can do learning sessions on an overview of what the NMC does, our fitness to practice process, and let you know a bit more in depth about that and what happens. We can do learning sessions on record keeping, accountability and delegation, introducing the NMC to nursing and midwifery students, preceptorships. And I know that there's, like I said, there's a lot of work that Skills for Care are doing in terms of preceptorships and getting people into the independent health and social care sector for that. So also internationally educated professionals. So we know that in your sector, you do have a lot of internationally trained nurses or nursing associates that may come into your establishment. So we can do sessions on that. Midwifery matters wouldn't really apply to you guys, but yeah, just professional. We can also do things on professional behaviours and patient safety workshops, and we can collaborate with the GMC and other regulators to come and give those sessions to you. So in terms of staying in touch, so we do have NMC newsletters, which we'd love for you to join, just so you know what's going on with us. And then this is the number for our advice line that you can call. And also we have our email address there. You can also keep up with us on social media. So we have X, I still call X Twitter, but you know, you have to X, Facebook, Instagram, and also on LinkedIn. So yes, so I'm here to support you and the NMC is here to support you. So thank you all for doing what you do within the independent health and social care sector. We really appreciate it. And I look forward to working with you all in the near future and coming and doing some learning sessions and see how we can work together. So thank you so much for your time. And I think I have time for questions. So if anybody has any questions, please shoot them at me now.
Okay, thanks, Tawanda. There is a question being put in the chat by Patricia. Can you support any of our international carers who were previously nurses to get their PIN and become nurses in the UK?
We can. So there's a process at the NMC that is, and it's part of the registrations process. So if they were previously nurses from the countries that they came from and they have nursing qualifications, then there is a process that they go through the NMC and they can get on the register as a nurse. I can give you a little bit more information about that and about the registrations process and what they need to do that. And we can have a little bit more in-depth chat about that. Yeah, does that answer your question?
I think that would actually, Tawanda, be quite a useful document for us to have because of the work that Lcas is doing with displaced workers.
Okay.
That has come up before. And I mean, I'm sure there's a lack of reciprocity, but there could well be people who could move forward and become nurses. And let's face it, there's a shortage.
Mm-hmm.
Can I add in as well? I think it's really important. One of the things, especially in the sector, is that we want a pathway of progression for future career development. And even though they may not be nurses right now, their starting journey could be starting as a care worker, but eventually they may want to lead to becoming a nurse in some shape or form. So it would be good to see a career pathway, for example, a care worker, then it links into maybe becoming a nurse, what would they need to do, maybe the potential qualifications and what it would entail. So that would be really helpful for the workforce. I know some providers would probably think, oh, I don't want to lose my staff, but also as well, if you're going to lose your staff anyway, what you could do is have them for 2 to 3 years, upskill them as best as possible. So if they are going to lead to become nurses, at least they've managed to get the best out of them as well. So we understand that with this sector, there's so many things that can keep people there. So it would be good to have that understanding. You also mentioned as well some of the sort of sessions that you do. Is it a national virtual session, or how is that organized for the providers?
Yeah, so how I want to do it is I'm happy to meet with individual providers. I'm happy to meet with you, or if we can meet, if you have providers that you have regular contact with, you want to do something together. But what I would like is maybe not large groups, but maybe smaller groups, maybe 10 to 20 people, because then I feel like it'll be more interactive. I can get our message across better, and there can be more time for question time and things like that, and see how we can work together moving forward. So I think our plan is for us to meet with individual employers and maybe a group of 3, and see how it goes, and your team, and I think that would be better for us.
Okay, well that's great. I mean, I think whilst you set things out, and if you have some dates, then we can share the dates, for example, with our providers, or maybe there may be another discussion of what you feel is really important as well. I think as we go along, I think there'll be lots of learning along the line. I think one of the things that people don't realize is that there are a lot more nurses in social care than people realize, and actually the role of the nurse is more common, especially with now we have more complex care that's happening. A lot of nurses are coming into the sector to have to deliver various medical needs as well for the end user. So I think it's important, and I think everyone is always famous for having the pin and being a nurse and so forth. So
Yes.
it's still trying to really recreate that, because as you know, and I'm sure everyone knows, it's not just the care workforce that are struggling, also the nurses as well. So I think there is a link there as well.
Also, what I wanted to just put across as well was that, in terms of you guys that are managers, your employers of nursing midwives and nursing associates, we also want to know what kind of themes come up in your organizations or in your care homes. So, for example, like some care homes might have themes like where they're having issues with professionalism, or they're having issues with record keeping, or what are the themes that happen in your particular establishment, and what are, if you've referred nurses, midwives, or nursing associates to the NMC, what are the reasons why you are referring them to us, and can we come in and can we help with that? That's also something that we would like as well.
I will raise one point, which comes
Yeah.
up quite often, is the
Yeah.
recognition of nurses working in social care to be recognised as nurses, especially in regards to the NHS and NMC, because they feel devalued being part of social care and being a nurse, but they still still have the same, they're still a nurse. And I think this
Yeah.
is one of the things that they want to be acknowledged as well. That's some of the things I find with nurses. It's not a step down by working in social care as opposed to working in the NHS.
Yeah, absolutely not.
I think Dudley makes a very valid point. And as the government's plans for neighbourhood working across health and social care come into play, we will see a greater impact of nurses. We will also likely see changes around areas such as delegated health tasks, which will also impact on if you like, the nursing content. And as we move towards a more digital approach with shared records, then it is important that both nurses and healthcare staff not exactly talk the same language, but each understands what the other is saying and what is needed. And if you look at the present situation of blocked beds or beds in hospitals that don't need to be moved out, there needs to be better cooperation between the two parties, and also linking in with local authorities there. And again, one of the issues that comes up in the conversations is around the levels of training of adult social care staff. So we would always encourage you to access free training, LDSS, to upskill your staff. And again, that knocks on to CQC. And I've just seen that Patricia has put a line in saying we have issues with district nurses enforcing a hierarchy and not recognising the work of care workers. Patricia, can we please talk about that outside of this meeting, because we hear it time and time again, and thank you for raising it. And if other people on this meeting today have that similar problem, please give us examples. We aren't going to go around accusing nurses of this, that, and whatever else, but it's about, through bodies such as the NMC, that area of nursing can be approached to basically get their act together and not act in the way that we do see them acting. And again, I'm sure there'll be dom care providers here who have had issues with district nurses or community nurses not turning up for appointments, and then complaining that the care staff had gone when they turn up an hour later, and then raising the safeguarding issue about it. We need to know about these things, then we can do something about it. So please let us know. And if you don't want to do it directly, do it through us. And, you know, there is no, no danger of putting your head above the parapet and getting shot in that sense. We can raise some of these issues anonymously, but bodies like the NMC and CQC are actually wanting to listen and improve. Any more questions for Tawanda? And Tawanda, I will put Patricia in contact with you so that you can communicate directly.
Perfect. And just to end, if there's any of the learning sessions that I mentioned that you feel will be of value to your organization, I'll put my details in the chat. If anybody wants to email me or contact me, again, I'm happy to come and do learning sessions. I'm happy to come in person or do online. If you have your managerial team, or if you have any professionals as part of your training sessions that they do every year, if you want me to come in, that would be perfect. But I am really keen to hear from you all. So please email me.
What we could do, which would be a suggestion to Wanda, is that we work obviously across London. So from a regional point of view, we may be able to put a date in for a region. And maybe if you suggest a topic or some topics, maybe they can get a group together. And whether you probably may be able to do that virtually or in person, it depends. So that might be a suggestion of dates, which might be helpful.
No problem.
Right. Thanks very much, Tawanda. We now have Anura with a very interesting research project around care workers. So Anura, over to you.
Thank you so much, Peter. Thank you for offering me the opportunity to deliver this little talk to our lovely regional managers. I think Dudley made a very valid point about nurses feeling undervalued or their work not being recognized. And Patricia also said some kind of similar narratives about care workers' recognition. And my talk today is closely aligning with those narratives. So, Peter, if I can share my slides, if that's okay with you. Right. Right. Okay. I hope everyone can see my slides here. Peter, can you see it? If you can put your hand up, please. Oh, brilliant. Okay. Thank you so much. Right. So my name is Anura Kalubowila. I'm a nurse, an NMC registered nurse, and also a care home manager. I work for an organization called In Mind Healthcare. My home itself is called Pearl View Nursing Home. Currently, I'm undertaking my doctorate at University of Bath. My research interest is around workforce and public perceptions of care home workers' roles and its impact on staff retention. So the title of the project is this, how perception of societal attitudes shapes turnover intentions. This project will be supervised by two supervisors, these two individuals, and it has got the ethical approval from the university as well. So what I'm going to cover in the next 10-15 minutes, I think, is to give you a brief introduction and provide you a research question that I'm going to investigate on and provide objectives that I'm planning to achieve, and a bit of a literature review and what are the key themes that I could identify in the current ocean of literature. And the methodological approach I'm going to follow to come up with solutions to the issues or find outcomes, and also how to participate, you as care home managers, in this project. And also, if you have got any questions, I can answer them as well. Right, so let's start. Introduction. So care homes are providing a vital service to the care or the senior citizens in our society. We all agree with that because we all are care professionals. And the most critical part of care home is the actual staff team who physically deliver the care to our residents. However, the recognition and appreciation for care worker roles has been always poor, and they don't get the recognition that they truly deserve for their valuable service that they provide. Recent research indicates that societal attitude towards care homes is overly negative, and I think Tawanda mentioned about the British Social Attitude Survey. Similar, survey has been conducted by the same group, I think, and the findings was alarming. The majority of, or more than, I think, 2/3 of people are reluctant to go into a care home when they want a care home placement in the future. One person is referring the feeling to as jumping out of Tower Bridge. Rather than going into a care home, I would jump out of the Tower Bridge and kill myself. So that's those kind of strong statements people have made. And the issue is these perceptions can affect the actual staff team themselves, feeling undervalued, marginalized, and stigmatized. However, this particular area of research has not been comprehensively studied by any researchers in the UK. So therefore, I thought this would be a fascinating and interesting area that I could delve into and find some answers, or look at the experiences of care workers themselves towards these perceptions. So my research question is, what are care home workers' perceptions of societal attitudes towards their occupation, and how do these perceptions shape their turnover intelligence? I'm specifically looking at the care worker roles, the perceptions towards care worker roles, rather than the care homes themselves or elderly population themselves. Just looking at care worker roles, people who deliver direct care, like nurses and healthcare assistants. What perceptions that the individuals in the society have towards these roles? My objectives, I'm looking at 4 key objectives to achieve. So what care home workers think about these perceptions. So do these perceptions affect their longevity, or stay in the sector, or leave the sector entirely? Do they think that these perceptions can be improved? If so, how such a change can be achieved? And the last one is to fill a knowledge gap, because there is a lack of enough evidence surrounding this particular research area. And so hopefully any findings could influence the social care policy around workforce development and recruitment and retention. So why is this research needed? Care home is often overlooked in research, as we know. So when it comes to NHS, there are a lot of research taking place, clinical trials and so many other research as well. But care homes often neglected in research. And this is a novel topic. No one has previously studied, and there hasn't been comprehensive studies, as I said. This study aims to fill a knowledge gap and may influence social care policy. So those are the reasons why this research is needed. So sorry, I'm going a little bit fast because I've got limited time. Current context and the sector-specific changes. So why this is so significant? Why do we need to research on this particular subject? Because we understand that there's a huge demand for elderly care placements in the future, and the predictions say that we need, I think, about the current bed capacity should double by 2040, I think, in order to meet the demands of the elderly population in the UK. This is because people live longer, because when you live longer, obviously people will develop chronic illnesses and cognitive difficulties, needing more specialized care like care home placements. And healthcare staff shortage is a global issue. And it has been regarded as a national threat to the UK as well. So in about 6 years' time, the current health and social care sector will need another 500,000 of staff members to fulfill the needs of the elderly population. But there isn't any effective system or strategies in place to fill this gap. High staff turnover, 30.4. This was last year. So when people change their jobs or leave, a new staff come in, and that can affect the continuity of care. And that can, of course, affect the organizational costs and team productivity, and people will be left with unmet needs. So CQC referred to this as a tsunami of unmet needs. This is something that I found in the literature. Poor social interest to work in healthcare, health and social care sector. This is quite significant as well, especially younger generation. So we don't see many young people coming to, apply for healthcare jobs in our care homes. So we are just solely relying on, mid to older age staff members. Therefore, our workforce seems to be getting old as well. There's no young influx of people coming into work in the industry. And recent research indicates that the general attitudes of social care is overly negative. This is the 2024. This is the research I was talking about earlier. So why? What are the factors that contributing to high staff issue in the UK and internationally? And underinvestment is kind of a recurring theme that came out in the research. It's not just the organizational level, but from the government level and the policy level, underinvestment has been critically criticized in the literature. Poor working conditions is often regarded as one of the issues why people do not want to work in the industry. Low pay is very significant. We all know that the majority of the care home workers are paid national minimum wages, and that has impacted the people to make a decision whether to stay in this sector or leave. And extended hours, some homes, sometimes 12 hours, 14 hours. So there's no enough provision for, to have a work-life balance. Insufficient training is often highlighted. Burnout nature of the work and lack of career advancement is one of the key themes identified, particularly in the research in Australia, and the poor recognition. Right. So all these causes for workforce crisis have been. I have put everything together in a kind of in this picture here, and I could look at certain factors, and I could sum them up into different categories like external factors, internal factors, leadership, and personal factors, job-related factors. And as you can see in this picture here, I have grouped them. So first 5 areas have already been researched enough in the UK and internationally, but it's the last one, external factors, that has not been researched on sufficiently. That's why I really want to look at the specific external factors that can impact the society to have a negative impression about or attitude about the care homes. These external factors are reinforced by various themes that I could identify in the research as well. So this is one of the key themes that I could identify in Far East Asia. So care is dirty work. So this the concept of dirty work is often highlighted. due to the nature of the work or repetitive tasks we undertake in care homes, and also it's a bodily functions, bodily fluids that we deal with. Therefore, it is referred to as dirty work by some of the professionals or some of the healthcare workers and some of the members of the society. So that narrative sits in the society that can shape the way people see the care home roles. And the stigma attached to care homes and elderly population. So stigma is quite significant as well. Care homes are referred to as old people's homes, places for death, end-of-life care, last resort, and place of abuse and neglect. So those are the words they used to describe care homes. And also stigma attached to elderly population themselves. So old people are uninteresting. They unfairly take taxpayers' money or use taxpayers' money towards their care at the latter part of their lives. So that stigma sits in the society as well. And the care work is feminine. So we know that it's about 83% of the care workers globally are females. So according to WHO, female occupations, female dominant occupations are 28% paid, 28% lower than male dominant the professions. Therefore, when it comes to care, it's underpaid. So they deserve this kind of a rate. So they don't need a higher rate of pay. So it is often migrants' work. So if we move into a different country, care work is something that anyone can step into without any knowledge or skills, and they can get on with the work. So it is often regarded as, oh, that's migrants' work. And negative media portrayal of care homes is often significant as well. This globally, always portrayal of care homes have been depicted negatively. We understand, certain situations where they have to talk about, malpractices, abuse. However, these are isolated cases, but it impacts the whole range of care homes or entire sector. And they often do not talk about, great care or great stories that come out from care homes, because they like the negativity. Stereotypes, care home staff do not need skills or qualifications. Anyone can do care. They don't need the specific skills or qualifications. And lastly, impact from COVID. Care homes were unfairly blamed for excessive deaths during the onset of COVID pandemic. But research later found that there was no correlation between poor standards and the excessive deaths. That's one of the studies in the USA. So these criticisms were baseless. So these are some of the findings in the critical research. So you can see that these repeated so narratives are repeatedly highlighted how care workers feel about their work, second-rated status in the USA, and public attitudes towards care homes may have an impact upon the I think I can't, sorry, covered with my screen. Anyway, so recruiting ability to recruit leaders and high quality staff. We have heard of staff feeling embarrassed about telling others that they work in a care home. And I'm not going to go through every single one of these, but there is a there are a lot of studies that have highlighted this issue of demoralization and undervaluation of care home workers' roles. So, looking at all this, I wanted to investigate my research question, and the methodology I'm going to follow is a qualitative design. So I want to speak to care home staff to find out their experiences about this negative perceptions that sit with the society. And I'm trying to get a rich and in-depth data from the staff themselves, qualitatively, and then do the analysis to find out if there's any themes that we can identify, and whether care home staff think that there's a remedy to this issue. So this is my approach I'm going to use. I'm not going to talk about every single step here. So sampling, so I'm looking at about 20 participants across care homes in London. The care homes must be located within one of the 5 regions of London. And I'm looking at registered nurses, probably 10 nurses and 10 healthcare assistants to take part in the study. Inclusion criteria would be that care homes must be registered to provide nursing or residential care for people over 65. And so as I said, this should be within London's 5 regions. Only nurses and healthcare assistants or support workers can take part. So that means ancillary staff or any administrative staff can't take part. And experience of 1 year minimum in care homes is required as well. So data collection will be, as I said, semi-structured interviews, meaning that there will be a pre-prepared questionnaire, open-ended questions I will be asking. It's the same kind of questions I asked from each individual. These interviews can take up to 1 hour. It's face-to-face or online can be done as well. And as I said, 60 minutes, and each participant will get a £25 voucher as a vote of thanks. So data analysis will be, I'm not going to talk about this area either. So it's just a specific mechanism I need or a tool I need to use. So how to participate? If you are interested in your staff to participate, please simply drop an email to this email address, or you can ring me as well on the number. And your responsibility is very, very small in this study. All you do is to nominate someone. It could be an administrator or your deputy manager. I know you can be very, very busy as a care home manager. So you assign that responsibility to someone else. So I can liaise with that individual, and I can ask them to share the participant flyer, which is this one. We have got 2 flyers there, one for the employer and the other one is for the employee. So I want that person, whoever you assign the responsibility to share this participant's information sheet and also the flyer, so that they can contact me directly. So thank you for listening. Sorry, I think I had to rush to do this because of the timing issue. I hope this made a sense to everyone, but if you have any questions, you can ask me as well. Thank you so much.
Thanks, Anura. Very interesting, and we do try and encourage you all to respond to surveys, because we all know that there are problems in adult social care. Many of us have worked around them for years and years. That there is some improvement. It's interesting that you mentioned the getting young people into social care. We've again, this is a favourite task of Dudley's, and he's very prepared to go grey and old doing it. It's very hard work, and one of the issues that we found is that many of the care providers, the organisations, are run by older people who simply don't know how to talk to younger people, and there is often a tech gap. You know, the sort of line that no one under 40 actually writes anything, they all use a gadget, whereas people over sort of 50 write everything on a post-it note or similar. It's comes up again with CQC. Are you looking just at care homes, or are you looking into the greater dom care market as well?
I am not a pitch at the moment, so I have to be very specific as to what kind of population I'm approaching. So it will be quite hard to diversify the care home, the group, and try and do look at all the services, because they could be unique as a sector, but it all come under social care umbrella. But when it comes to research, it has to be very specific where you are looking at, what kind of a cohort of people you are looking at, what kind of a geographic location you are looking at. That's why I'm limiting this research to London 5 regions as well.
I mean, we see, I mean, dom care is obviously the bigger section of the market, but I think the conclusions and the points are common.
Common as well, yes.
And
totally agree.
When you get to your answer points, those answers will be useful for dom care as well.
Absolutely, yes.
And also, just very quickly, there is a vast range of areas that you've mentioned, and I think you could sit in a room with many providers and they'll give you 101 different concerns and issues, but we know there's main topics at present. Just drawing it back down for everyone in the room, for anyone in a care home setting who wants to get in touch, I think it's important. I think there is some good news there. It's a £25 voucher, which I think you give at the end of it, is it? Or they have to...
Yeah, it will be given at the end of the interview, Dudley. Yes.
Okay, no problem. So there is something in there. So anyone who wants to...
Yes.
It can make a big difference, or you can do it yourself and put it into the Christmas raffle or bonus or giveaway if you want as well. So it always helps as well for that, something like that. And your times stretched from when's the period end for your research time for people to book in?
I mean, I'm aiming to end all the semi-structured interviews by midweek of January.
Okay.
So sorry, second week of January.
Okay, that's fine. So just we also know that sort of December can be a bit sort of busy. So
I can be flexible as well. Even if it goes to beginning of February, I should be all right still. Okay.
Oh, and one last thing, is this done? Does it have to be done face to face, or can it be done virtually as well?
Preferably face to face, but we understand certain constraints as well. And if someone would like to do it remotely, I can do it remotely as well.
Okay, well, I think someone in the group is keen already, so you may be able to have that in as well. So thank you very much.
Contact details in the chat, please, Anura. Someone wants to pick them up, so let's strike whilst the iron's hot.
Lovely, thank you.
Okay, so yeah, I think it's good because it's good to have someone who also works in the sector trying to push the boundaries. Outside of what Anura is doing, we as Lcas can be a driver. We speak with people at the DH, we speak with other parties in a significant area, so we're able to drive agendas as well. So it's something that we can do as a group, and the more people that buy into it, we can determine and help change the attitudes of what's going on. As Peter mentioned, I have a passion for trying to get younger people into the sector. I think it's been done very badly of how we attract younger people to the sector. I also do a lot with more inclusive and diverse working environments. So, and understand as well that culture appropriate care is really also another factor for me, which is hugely important for, especially as we're more London based, the generations of those who are becoming more older now are from a different mix of different ethnic backgrounds, and actually staff being able to understand how to work with them is also important. And I think these are sort of areas which are really a key element for me in pushing out. And so you'll hear a bit more from me in regards to that, but actually trying to see, and research behind it was also very helpful to set about how we can people can receive better levels of care as well. So that would be one of the things I share. So I'll get off my soapbox now, but thanks very much for coming in. And if anyone wants to have any questions in the chat, they can share information. Peter, I'm not sure if you want to, I'll leave that to you to take on from there.
Okay, I mean, if there are any points for Anura to discuss now, please raise them. The contact details in the chat, and we'll circulate it individually, and we'll also circulate it as a part of the recording of this meeting, along with the presentation sets as well. And if you could please send those to me as well, Anura, then I will do, Peter. Thank you so much, Peter, again.
Thank you, and
No
Dudley.
problem.
Thank you, everyone, as well.
Great. If there aren't any more questions for Anura, I will. I've got two sets of slides which are linked together. One is social care fair pay, and the other is the Employment Rights Bill. Now, neither of these are imminent, but they are both points of great importance that will affect social care working forward. So, firstly, what I'll do is I'll do the a social care fair play, if I can find it. Oops.
Whilst Peter's looking at that, I know there is the issue it's come around not just for the international workforce, but also with homegrown talent in regards to the London living wage and other things around that and staff. And so I think as a business, it's very important to also manage and look at how you're going to cope with things such as that happening as well, and managing not just your international staff but homegrown talent as well, and keeping them there as well, because it's a tricky act especially as you've got to be sustainable as a business as well. Peter, I'll leave it back to you.
Okay, thanks, Dudley. What I would say about both these sets of slides is that as they were put together a couple of weeks ago, over the past few days, there have been various add-ins, and these are things which are changing quite regularly. So do keep up to date, and again, where there are surveys, where there are areas to comment, please do. It's a staged process, and the government accepts that this will affect and raise costs. And the Fair Pay Agreement is designed to compensate for that and increase pay levels. Much is yet to be decided, so please take note of updates, as I say. It's worth mentioning at this point that the government may change the fair funding review, and this would likely benefit some local councils should it happen. As an example, the government isn't going to put more money in. What they're doing is resharing the money that's there. So some local authorities, it was mooted at one point, for example, that Camden would lose something like 25% of its funding. That would be a disaster. That looks as if that type of thing will be altered. Whilst Camden was going down, Haringey was getting more money. So these are things that as providers, as businesses, as organisations, you need to be aware of. So there's a fair pay negotiating body consultation, and this was launched in September, and to say it's a staged process, and they are looking for people to join, comments to be made. Again, if you don't want to do it directly, contact us, because Dudley and I go to various meetings about this. We also work with the London Living Wage people. We also go to various all-party political groupings at Westminster, where we can raise these points with, in theory, the people that are making the decisions. And we know that whilst it's difficult to always make impact, we can do that. The majority of adult social care provision is funded by the state through councils and the NHS. So the government will financially contribute, and the spending review allows for an increase of 4 billion, but that's not until the 28-29 financial year. And a sum of £500 million has been earmarked for improving pay terms and conditions. So the additional funding will be paid to councils to reflect the increased cost of care, and it will then filter down. And the government believes that funding for adult social care should be targeted towards those providers who are socially responsible, who do not pass on costs to councils if they can cover these themselves. That phrase is one that can strike fear to the heart. It does seem to reflect the view that many councils have, in that you should work for next to nothing. We're all aware that the big sector of the market is dom care. and we're seeing London local authorities paying less than £18 an hour. It's not workable in the long term, and it certainly isn't workable when we get into fair pay and the Employment Rights Bill. 500 million seems a lot of money. It is a sort of red top headline, but it isn't actually very much. If you've got 150 local authorities, it's about 3.5 million per local authority. And if you look at the number of workers, it's equivalent of somewhere between 20 and 30 pence per hour per worker, which I accept is a big change, but how is it going to be shared out? Again, watch the space. The consultation actually is covering 6 areas, which you can see here. You also see the broad timelines. Now, for providers, we, as Dudley has said, Lcas is a part of the Care Association Alliance. The Care Association Alliance is a part of the Care Providers Association, which groups together and meets regularly to work with the likes of DH, etc. We attend many meetings ourselves, and where we're able to raise points. We are a lot better at raising those points if you give us the ammunition. So if you've got issues you want to talk about, contact us, because we're interested and we want to take them forward. On the slide, you can see there's quite a lot of links. Now, there's actually under the bit about the King's Fund, there's a link there. That's actually a film that you can watch about fair pay. It's probably not going to tell you anything you don't already know, but it does lay it out. And you may well like to share some of this information with your staff, because their thoughts are relevant as well. There have been 25 events so far around fair pay in social care. And by the end of December, they will have delivered 72 engagement events. And that number is growing. There are links there on X, on Facebook and LinkedIn, where you can access those. So please do, and please make your feelings known. Now, before we move on to the Employment Rights Bill, are there any points about fair wages? Has anybody come across any issues so far? Silence is probably not golden.
It's not. Hi, Peter. Can I raise something, please? I'm looking for somebody, an HR professional, really, to support us in looking at what we can do, because the whole fair wage thing is scaring the head out of me, to be honest. And I would like to change, as an organisation, as a business, I would like to change how we are paying staff and how we can consult with staff to provide them with a new contract to be able to fulfil the needs of the fair wage bill prior to the last minute.
We could well be able to answer your prayers, because I've been talking with an HR group
I'll let them know.
who are looking to put an event together for us, which will be in early 2026.
Yeah.
And this is part of the area that they will be covering.
Right, thank you.
And if you've got, if you want to have a word with me outside the meeting, then we can use this as part of what we're asking them to do, because we've already, some of the points that you've just raised are points that I have actually spoken to them about. The other area that you may well be able to get information from on a regular basis is Citation. And many of you, I would guess, already are signed up to Citation. They're very good at sending us information, which we pass on. And they've got a very big HR sector. And at the next meeting, we'll have a young chap with us from Unison. And Unison are also, if you like, they're spreading their wings into adult social care. And this is one of the areas that they're keen on. But the points you raised, Patricia, are pertinent. please do have a word with me. And as I say, we are working with an HR organisation to put something together for early 2026.
Also, very quickly, Peter, and going back to the last points I was making, I think as a sector, we don't really work from within, like training our other staff to do some jobs on roles which would be very helpful. And there's also elements around apprenticeship, getting younger people back into the sector, or even those who are from the DWP, or there's various funding and supportive sort of roles in which they can do it. So which does help for us as providers, because we usually panic when there's a vacancy and we don't actually know what's out there. So I'm hoping maybe by our next session, if not by that time, we may have some elements or try and do something with Lcas where what's available regards for the funding and support for the workforce as well, and what you can utilize around apprenticeship, so you can actually not have to stress and have a look at different options. So I think it'll be a good thing that probably I'll speak to Peter about this and how we can look at what sort of providers are looking for, because I know every time people are looking for employment, and we know the national and overseas workforce as well, but there's more available than you think.
Okay. Before you all die of boredom, I will just run through a few points on the ERB. Okay.
You've seen Kat's message about
Yeah.
tomorrow?
Just looking.
The Employment Rights Bill, why is it important? When will it happen? So the time scale for this is, as we've just covered, most of the changes will occur next year and the year after. The bill is going through Parliament. It's bouncing backwards and forwards between House of Commons, House of Lords. It will change before it becomes law. It will introduce additions and amendments to existing legislation, including the 1996 Act. Until the changes happen, work with the 96 Act. You will probably get people contacting you, offering you fantastic services, saying they already know what's going to happen. They don't. I say we're getting some HR people to come in early in the new year to talk through the process. You can use the ACAS website. There's an awful lot of information on there. And also, if you've signed up to Citation, they will be keeping you up to date. When the bill becomes law, what will happen? A lot of this stuff may well not apply to adult social care providers. There's a lot of scaremongering about trade unions and trade union recognition. It will be a requirement, and we've got Unison coming on December the 10th to the next meeting to talk about this. One thing that may well make a big impact is the regulation of 0-hour contract. We don't have a timescale. We don't know what's going to happen. And there are two very divergent schools of thought here. We've got large providers who are saying, oh, our staff want 0 hours. And we've got many staff who are saying they don't want 0 hours. Many staff appreciate some flexibility, but that's not the same as enforced 0 hours. And as I'm sure you're aware, HMRC HMRC adult social care sector as a target area for exploitation of staff through incorrect use of payment processes. So again, get that right. And if you're using an outsourced provider for things like national insurance and tax, make sure they're actually getting it right and documenting everything, because we still see providers who are not providing proper paperwork around pay, and that is a requirement. April 2026 changes. These are basically a few things that are going to make a difference: paternity leave, parental leave, sick pay, and redundancy protection. I'll come back to sick pay because there's been a bit of a change in there, but these are likely to be on costs for your organisation. So we carry on with the changes. Whistleblowing. Whistleblowing is a big area of problem at the moment. You'll be aware, for example, of the issue that a whistleblower at CQC was not properly safeguarded. You've got gender pay gap, back to trades union, and the Fair Work Agency, which is part of the employment rights. So without going into too much detail, I think let's wait and see. As things come through bit by bit, we will keep you informed as best we can. Employment Rights Bill, fact sheets. Again, you can pick up the information from this web link. You may groan when you see it's a .gov.uk. There's some very useful stuff there. There's a lot of fact sheets. They're comprehensive, and some of them I would suggest that you download and either send on to your staff or stick on the notice board in the canteen or in your office so that people can have a look at them. Now, there's a list of contacts here, open consultations, so you can join in. The actual completion dates for these all vary. Why they vary, I've no idea, because it's all about the same thing. But they're open consultations. They welcome contributions from organisations, small to medium-sized enterprises, and I guess most of you fit that title, make up 80% of adult social care. You are hugely important. Do take the opportunity. And one area that is particularly interesting is around statutory sick pay. We know this is changing from April 26th. It's coming in. It will eliminate the 3 waiting days. So it will be day 1 entitlement. There may be some changes to this, but what you need to do, the key calculation, if you like, for you from a cost point of view, is the difference between 1 and 3 days cost. So you can work that out, or your accounts advisors will be able to work that out. And also the removal of the lower earnings limits for SSP. So you will need to have your policies updated. So if you subscribe to policies from Citation or QCS, they will do that for you. But you need to make sure your staff are aware of what those changes are, of how it relates to them, what difference it makes. And you make sure that you actually put those changes through your payroll and HR systems. And you may need to budget for increased sick pay costs, if you like, especially for lower income or part-time workers. And that is it for that. These are on, or they will be on the website. There's a lot of useful information there. It's not very interesting, it's not very exciting, but it's absolutely vital. And if you're inspected by CQC, by the local authority, or if you have a safeguarding issue or HMRC come in, they will expect these points to be covered. So you need to do it. And as Patricia said, it's very confusing, but we will bring somebody in who can explain it, and they will also make themselves available, etc., etc. Any questions at this point, or points from Dudley?
Thank you very much for that, Peter. As you said, it may not be the most riveting topics, but when it comes to business sustainability, these are one of the things I think
unfortunately, Dudley, you're breaking up very badly. In terms of...
As a manager, as an owner,
We can't hear you, Dudley.
the staff you're hiring, and this is going to be a big factor of survival of a lot of the businesses we've been around for the better. Okay.
Just a couple of points before we go. The next meeting is on the 10th of December. So next meeting's on the 10th of December. Lcas we've got a contract to roll out better support, better care across parts of London. That will be picking up on what many of you would have known as DSPT and getting NHS mail. So that's obviously an important area. We'll bring that to the meeting. We'll also have Skills for Care there because they've got some very useful updates. And as I say, we've got James Malloy from Unison. So we look forward to seeing you there. One other point is that Lcas, we're looking for you to help us help you. One of the things that we're actually doing is we're setting up an Lcas steering group. We've got quite a lot of people who are already wanting to be on that. But if you would like to join in, then by all means contact me. I'm very happy to have a conversation and I'll send you some more details. My contact details in the chat or they're on the website. Dudley has now disappeared altogether, but we will process the recording and we will post that and the slide sets and any further information on the website in the next few days. So I would just like to thank you for attending. I'd like to thank Anura and Tawanda for presenting. And hopefully Dudley gets out of his car park safely and returns. And as I say, thank you very much. Look forward to seeing you in December. And any questions, do please contact us and we're happy to take them. And if you're having problems with international recruits, again, if you need legal advice, we've got partners who can help you, etc., etc. So do please let us know and we'll do what we can to assist. And thank you very much. And you can now have the rest of your day back.
Thank you very much, everyone.
Thank you. Bye.
Bye.
Thank you. Thank you. Bye.
Bye.